most parents will do whatever it takes to get what's best for their child. Poor school performance, forgetting homework, a short attention span. These are just some of the problems many parents deal with in children who have some form of attention deficit hyperactivity disorder. And parents go to great lengths to help alleviate these symptoms. And well, right now, 8% of young children and 6% of adolescents are diagnosed with the disease. A Savannah physician says there are many more out there not getting the care they need.
We're not finding it nearly as much as we should, and we're not treating it nearly as much as we should. Despite all the rumors, the Council on Medical Affairs has looked at this and found that we are undertreating by about a half.
Well, on a special health report tonight, Holly Bounds joins us for a look at a unique type of treatment happening on Hilton Head. Holly?
That's right. Well, it's a non-invasive method of monitoring a patient's brain waves. And those who provide it at Wellness Solutions on Hilton Head Island claim it is the ticket for those suffering from illnesses like insomnia, chronic pain, and even ADHD.
And hold on to these right there, because I'm about to put this cap on you.
8-year-old Guy Annunziata has not been diagnosed with ADHD, but his parents chose to put him through neurofeedback therapy with hopes of improving his speech delay, school performance, and overall behavior. Oh, and maybe somewhere in that list, boost his batting average too.
And now I'm hitting them like home runs.
His father created this neurofeedback program called Brain Core Therapy and believes monitoring and teaching the brain can help children who suffer from attention deficit hyperactivity disorders. Dr. Kelly Graham treats those kind of patients through neurofeedback and says the way it works is simple.
It literally is a training program. We actually train your brain to fire a brain wave in the normal levels, and once it does that, the symptomatology experienced by the body just goes away on its own.
In kids who suffer with a form of ADHD, those symptoms can include problems listening and following directions, struggles focusing in the classroom, organization, and impulse control issues.
He got kicked out of this school, he got kicked out of that school, he got kicked out of this program.
Those very symptoms fit the bill of Diane Costo's son, William, but she refused to medicate him.
I see kids that are kind of like zombies or really lose a lot of weight on the ADHD medicine, and I don't think it's healthy for the kids.
Desperate for an alternative, Diane tried neurofeedback.
When I saw the brainwave patterns, they were absolutely out of sync. You know, he was producing too much of one brainwave when he wasn't supposed to be. So once we start to balance that out, then the body can function normally. And he wasn't as agitated, and he was able to just focus a little bit longer.
But for those whose symptoms are dramatically impairing their lives, avoiding medication could be dangerous. Now, another argument is these drugs can be addictive, and Dr. Graham gave that as a reason why some parents don't want their children taking the medications. But Dr. Greenberg says the stimulants have the same side effects as caffeinated soda, and they don't have children waking up begging for tablets. Then there's the big black market for the short-acting drugs. They are often sought by college students to focus on studying or to keep their weight down. Greenberg says this is a problem, and it's one reason they aim to use longer-acting forms that cannot be abused. Now, Tina and Russ have learned a lot over the past couple of weeks, and we could talk about this all night. But one thing I do want to point out is diet. The one thing that both of these doctors agreed on is that a balanced diet is very key in helping these issues. And one parent that I spoke to says that one way that they kind of treated their son was removing all red dyes from the diet, and it made a big difference for him. So diet, a balanced diet is very important.
A lot of valuable and interesting information there, Holly.
Thank you,
Thanks.
Holly.